Welcome. This is a short video which is demonstrating how to create an alert within HealthOne for patients aged over 40 of both sexes who haven't had their blood pressure checked within the past 12 months. For this purpose we go to the patient selector and from the patient selector we then select the icon configuration tool, which was formerly known as the HeathOne or HealthOne editor. Within this menu we will recognize the alert icon that we see when alerts are fired within HealthOne. If we open that, we're now displaying all the available alerts within my version of HealthOne, and this is how you customize these alerts. In order to create an alert for this purpose, we will need to create a new alert by clicking on the plus button or add alert button. We're going to give this alert a name, let's say BP not checked in past 12 months in patient greater than 40. There are three further sections beyond the title, that is patient category, triggers, and the alert message. We're going to create an alert message that will be displayed that says, please note BP not checked in past year. And then we're going to have this alert triggered only when the healthcare record is opened. Sometimes it makes sense to be alerted and reminded repeatedly during manipulation of a file, but for a simple health promotion alert, the most appropriate thing is that the alert would fire once when you open the file. And then we have to set the analysis that will select those patients for whom the alert will be fired. We do this by activating this panel by clicking on patient category. We're selecting all sexes. We want to select age between 40 and 100. We're selecting both GMS and private, and we're allowing the analysis to analyze test patients as well, because that's useful when we come to test the alert later on. We could elect to confine the alert to a particular disease group, but that's not relevant in this case. And here we are now, which we weren't able to some versions ago, we are now able to define an extraction formula directly from within the alert editor, which is a big help. So we're going to click on this icon and create an analysis to select or extract the patients we're interested in. So BP not checked in past year. And this analysis will look at all patients between 40 and 100 years of age who haven't had their BP checked. This will obviously be in the medical section. The date is defined by saying that we're interested in dates greater than a date exactly 1 year ago. And we do that by saying greater than date minus 1y. And here we type the name of the item that we're interested in checking, which is systolic blood pressure, and we want to say that its content exists. So if we save that, we'll effectively be looking for patients of both sexes, GMS and private, between 40 and 100 years of age, seen in the last year who haven't had systolic blood pressure recorded, or rather whose systolic blood pressure has not been recorded in the last year. So we'll OK that. Ticking or unticking is a very important decision here. If we tick this, remember what this will say is that it will trigger the alert where the systolic blood pressure content does exist within the past 12 months. But in fact what we want is to be only alerted where it doesn't exist. So we'll untick, and this will then trigger the alert when a patient between 40 and 100 of either sex, GMS or private, test patient or otherwise, has not had systolic blood pressure recorded in the last 12 months. So we will now OK that. That's our analysis created. Note that it's enabled here. You can enable or disable analysis on the fly by opening and clicking along this column. In this case, we have enabled it, and we are now saving that. When we then save this alert and leave the configuration tool, we can then check with our patients whether or not this works. And if you run this analysis, you'll find that when you click on a patient over 40 who hasn't had the report